Hello, everyone. I want to talk about something that may be familiar to you, even more if you have children, because when your child has fever with an unknown source, but otherwise good healthy appearance, clinicians know that it may be just a cold, but they also know it may be a serious infection, as it is bacterial meningitis, which affects the brain, is fast progressing, and can be deadly if not treated promptly. So the only way clinicians have to assess the absence or presence of the disease is by drawing and analyzing a sample of the cerebrospinal fluid, that's the CSF. That's the fluid that surrounds the brain and the spinal cord. And this is done by means of a lumbar puncture, which is an invasive procedure that in about 25% of the cases, blood contaminates the sample, leading to unreliable results. So because clinicians don't want to take the risk in these cases to miss just a single case of bacterial meningitis, they're going to hospitalize and treat these patients anyways. But the real problem is that in 95% of the children that go through the lumbar puncture, this bacterial meningitis is not the cause of the fever, meaning that their CSF is normal and that the lumbar puncture added no benefit to the healthcare. So the unmet medical need that we have identified is that of a medical device to non-invasively detect abnormal CSF in this population. Now that we're going non-invasively, there's no need to go through the lumbar area. We can go through the fontanelle, where the CSF is just a few millimeters away from the CSF, from the surface. And what we can measure is the increased cellularity in the CSF that is associated with the disease, because clinicians have defined a cell concentration threshold that allows them to distinguish between a normal and a meningitis-like CSF. What we have done in the lab is to use ultrasound-based technology to measure increased cell concentration in a model that uses animal tissue to replicate the real scenario. And what we have observed is that we can confidently distinguish normal from meningitis-like cell concentrations. What we want to do is we're on track of working on developing a low-cost bedside real-time acoustic microscope to look through the fontanelle. Because if clinicians had a device this size, they could reduce a significant number of lumbar punctures that uses needle the same size, and because they could also be reducing hospitalization and treatment costs that are associated to failed lumbar punctures. And third, they will be able to have a better knowledge of the disease just because they can non-invasively track CSF condition through time. In Spain, there are about 700,000 visits of young infants with fever who have the fontanelle open, and this is a new market. In the United States, this market is still larger and has a great upside potential. But we may want to move first to the young infant population in the sub-Saharan belt that concentrates up to 85% of world meningitis cases to obtain wide clinical validity through NGOs and philanthropic funding. And this is a great opportunity, I think, for a Madrid-based entrepreneurial venture, and we can generate this impact. We can do it because there's a driving force behind this project that is composed by the M+Visión fellows that have selected the necessary expertise from both institutions, both in Boston area as well as in Madrid community, in what we expect to be long-term and established collaborations. Thank you very much.